I love the phrase that they're using out there. Demographics is destiny. And the demographics fall into a bunch of buckets. There's this global population shifts that are accelerating around there. So just imagine people moving around the globe. And there's also a microcosm in the US population shifts that are not just the aging of our population. So everyone talks about the baby boomers aging in, but the migration, people moving around the country that are really impacting the work that we're doing. There's a whole nother aspect of the clinical provider population. So who is available to serve the health needs of today and the future? And where are they in their careers, in their geographic area? Are they moving? Are they changing? On top of that, there's a strained healthcare educational system. Are we producing, are we minting really good providers for the future in all different categories? And then there's this big supply and demand force. Is there more money? Is it going to require more money? Are we getting more effectiveness? How is it impacting satisfaction of not only the people that are being served, but the people serving those people? So all of those things fall in this demographics changes. The second thing we want to touch on today is the health insurers and risk-bearing providers. They're realizing the cost of expanding provider network, the cost of the expanding provider network challenges. The challenges are expanding and it's costing them a lot. So provider networks are failing to serve their member populations. This is a real frustration in a lot of corners of the healthcare ecosystem. Growing challenges in access, growing challenges in information, harder to get consumer choice out there. And a lot of the provider networks that are out there were almost solely built on geographic coverage. So we got enough to cover this area, but that's just not enough to solve these other areas around access, information, consumer choice. The provider networks have historically not been built on product market fit, where product is the clinical providers and the financial arrangements, and the market is the healthcare needs of the membership over time. So we're really struggling with what does that yield for us in our healthcare system. Then lastly, we want to drill into this rise of what's called the network lifecycle platform. How do we optimize the performance using data to help better connect clinicians, the clinician ecosystem with the member ecosystem? And that looks like it's almost predictive. If a stakeholder in the healthcare system could answer the question, if I knew X, if I knew something was going to happen, I would do Y, and I would use Z system to do that. So an X might be, if I knew a provider was likely to retire in the next 5 years, I would do Y. I would think about who I would want to backfill that provider with. And I would use Z system. I would use my provider relations organization or my CRM platform to accomplish the goal. So that's what we got teed up for today. I'm going to start with this industry landscape and challenges. This changes in population. I want to get your thoughts here, Stephen, on the shifts in the U.S. population. I was doing a little bit of reading. It's if you want to go to sleep at night, start reading census information. It's not really engaging written, but there are some really nice graphical summaries of what's happening out there. And I found that the regional population growth and decline trends are really interesting regionally. So the South is the fastest growing region. And some are predicting that from the pandemic ahead 30 years, there's like a 40% shift towards the South regions, Texas, Florida, the Carolinas, Georgia, Tennessee. There's a lot of migration into those, a lot of things, warmer climate, higher domestic migration from the Northeast, business-friendly policies. And so there's that against the lowest. The biggest population decline would be like the Northeast, New York, Pennsylvania, Connecticut, Massachusetts. High cost, aging population. Cities like Boston, Philadelphia, losing a lot of their older workforce. So how are you experiencing it from a healthcare lens, Stephen, when you've been thinking about the demographics?
Really, it's something over the last 10 years. 10 years ago, we started thinking about, or probably even earlier than that, the migration to what we call the Sun Belt from Arizona all the way over to Florida. And when you think about my area of focus was Medicare Advantage and the senior population. We saw a big influx in that Sun Belt region happening over time, and the trend saying it's just going to intensify. I think what today is it's not just in the senior population. We're seeing it even broader than that, where you have people that have not aged into that population yet that are migrating south. And so I agree that we're seeing this swell in the south. And do we have the right supply capacity of physician networks to be able to support that swell in the right disciplines and specialties, right? So that it's a Rubik's Cube of how do you predict what's going to end up happening? And you got to be thinking with a lens 2, 3, 5 years out in order to make sure that you're ready for it. But I agree with everything you said. It's coming true, and it's coming true exponentially fast.
Yeah, and when I think about the effects on the healthcare system post-pandemic, there's a lot of burnout of clinicians. So we're losing a lot of clinicians to retirement, and those who want to go part-time, they're going to go part-time, maybe in a warmer climate where they can walk the beach in the morning and then see a few patients through a telemedicine out of Florida. So there's that. And juxtapose that against this hybrid work environment.